Appendix 1 of the Clinical Practice Guide, Research and Enquiry Explained, makes the distinction between prescribed and bespoke research and inquiry tasks. The bespoke task is what I'm going to talk to you about now, and you'll notice from the week-by-week part of the Clinical Practice Guide that some weeks student teachers have got bespoke research and inquiry time. Now, what we talk about when we talk about bespoke research inquiry time is that student teachers will use it to advance an area of their practice that they're finding quite tricky, quite challenging, that they've had some targets in, or if they're a little bit further on in their development, they might be using that time to focus on an area of interest for them. Now, they might, at the beginning of Clinical Practice 1 or 2, when they're quite new to the PGCE programme, need some guidance about how to make the most of that time, and that's where you can support them as the mentor. We've included in this appendix a non-exhaustive list of bespoke research and inquiry tasks, and many of these are actually quite close to practice. It doesn't necessarily have to take them out of the classroom context, but some of them might. They include things such as conducting deliberate practice. So let's say, for instance, a student teacher is having difficulty developing the quality of their explanations in lessons. They might do some deliberate, focused practice of that particular aspect of their classroom practice in order to develop, in order to get some feedback. They might be better served engaging with different sources of knowledge during their bespoke research and inquiry time. So they might need to go off and do some reading about a particular aspect of their practice they're trying to develop. There are several other suggestions in this appendix that we recommend you have a look at in detail in order to make some suggestions to your student teacher so they really can make the most of that bespoke research and inquiry time.